Good afternoon. I am Tom Hudak with the Utah Department of Health. Welcome to this week's COVID-19 media briefing. We will hear today from Dr. Angela Dunn, the state epidemiologist with the Utah Department of Health. Dr. Dunn will be providing us with a situational overview.
Hey, good afternoon. We now have 10,497 cases of COVID-19 in Utah. That is an increase of 295 from yesterday. We have tested nearly 225,000 Utahns for COVID-19. That's an increase of 2,190 from yesterday. 829 Utahns have been hospitalized throughout this outbreak due to COVID-19. That's an increase of 28 hospitalizations from yesterday. The active hospitalizations right now due to COVID-19 are 108. We have a total of 117 deaths due to COVID-19. That's an increase of 4 from yesterday. All were male Salt Lake County residents. 3 were residents of a long-term care facility, and 1 was hospitalized at the time of death with underlying medical conditions. So I want to be very clear today that we have increased spread of COVID-19 in Utah. This past week, we've had a sharp spike in cases, and it's not explained easily by a single outbreak or increase in testing. This is a statewide trend. We started loosening restrictions about 3 to 4 weeks ago, and we knew that this would likely increase cases in Utah. It's not the simple act of loosening restrictions that causes cases to increase. It's what we do in society and with our actions that can cause COVID-19 to spread more readily. So to keep COVID-19 from spreading in Utah, it's really important that we take the following actions moving forward. When you start to participate in places in the economy and society, like going to stores or restaurants, avoid close contact with others and make sure you're wearing a face covering. Stay home if you have any signs of illness, no matter how mild, and contact your provider to determine if you should be tested for COVID-19. And if public health has asked you to quarantine or isolate due to COVID-19, follow their guidance. We have seen an increase of cases since loosening restrictions. Loosening restrictions does not mean that the risk of spread is decreasing. This means that we must continue to take actions as individuals to avoid unnecessary illness and death due to COVID-19 in Utah. I'm happy to take some questions.
Hi, thank you. This is Sophie Eppolito with the AP's Salt Lake City Bureau. I'm curious, Dr. Dunn, how worried are you about this rise in cases, and what do you think it means or shows about where the state is at currently?
So public health is very concerned about this rise in cases. It could mean that we're just starting the acceleration phase of the outbreak and can anticipate further increases over the coming weeks. So we're very much working hard at continuing our contact tracing efforts, making sure that the public is aware of the actions they need to take as individuals to stop the spread. And of course, making sure individuals have access to testing should they need testing for COVID-19.
Yes, hi, Dr. Dunn. This is Carter Williams with KSL.com. You talked a little bit about that this is something that's not specifically one place where this is rising, but are there specific areas in the state where this rise is happening at rates higher than others?
Sure. So we have 13 local health jurisdictions in the state, and 9 of the 13 experienced a greater than 15% growth in the past week. So this really is a statewide trend. We do have some jurisdictions that have seen, a higher rate of growth in cases over the past week. That continues to be, the southwest area of the state, but it is significantly a statewide trend.
And just a quick follow-up to it. You mentioned there might be some people who may not be following some of the guidelines that are out there. What are some of the things that could be contributing to this rise, specifically from what we've seen in the past week?
Sure. So we continue to see the majority of our cases being exposed through household members. The increase of kind of that more community spread is starting to jump just a little bit with the loosening up of restrictions, and the vast majority of our outbreaks are happening in workplaces. So what's really increasing the cases of COVID in Utah are similar to what's happening across the country. It's people being in close contact with each other indoors for a prolonged period of time. That environment is really conducive for the spread of COVID-19. So as we start to open up parts of our economy and society, more people will be working or in social settings where that environment's more likely.
Thank you so much. Dr. Dunn, Chris Reed with St. George News. I have a question and a follow-up. A lot of what you've mentioned about spiking cases, two things. Number one, should we be just looking at cases as opposed to hospitalizations? And secondly, the state commission is recommending that the state move towards what they're calling a smart green as soon as this Friday. With the spiking of cases, do you think that's a separate issue, or do you think that that should be done?
Sure. So what was your first question, Chris? The second was about the commission green.
Absolutely. So the first there was about the fact that should we just, a lot of people are saying you shouldn't be just looking at all the cases.
Oh, sure,
about the
hospitalizations.
increase
Right.
in the case rate. It should just be about hospitalizations,
Right.
which has gone up a little bit in the state, gone up a little bit more in some other places. Is that something is there an overemphasis on the case increase?
Yes, so we definitely track our hospitalization and ICU rates due to COVID-19. Hospitalization is a lagging metric. So typically somebody has been ill with COVID-19 about a week to 10 days before they're hospitalized. And we have consistently maintained about an 8% hospitalization rate. So we can expect that this increase in cases will result in an increase of hospitalizations in about a week. So it's really important for us to see the leading metric in cases and take action accordingly to prevent overwhelming our hospitals. With regards to your question about the commission, so the Legislative Commission, the Public Health and Economic Emergency Commission, makes recommendations to the governor based on a lot of factors. We in public health look at our public health data and make recommendations for restrictions or loosening restrictions to the governor and the commission. And based on the data we have seen in the past week, we don't recommend any jurisdiction in the state going to green.
Okay, and as a quick follow-up, kind of on that same thing, do you have any concern? There have been crowds of protesters, obviously in a lot of cases not practicing social distancing in Salt Lake, also St. George and Cedar City, to name a few. Should we expect an uptick in cases from that in the next 14 days?
Sure. So any situation where you have a lot of people gathered for a prolonged period of time and they're really close together, that is a situation where we're, of course, concerned for COVID-19 spread. So we're going to certainly be watching our numbers over the next week or two to determine if we do see an uptick. We do recommend that anyone who's in a situation like that, whether it be protest or other environments where they're in close quarters with others, definitely watch for symptoms for the next 2 weeks. Isolate immediately upon having even a mild symptom and contact their healthcare provider.
Dr. Dunn, hello. As we're going to yellow, and it seems like some people are misinterpreting or possibly not understanding the guidelines the state has. One example that we got today is the Spanish Fork Festival Days announced that they would keep their rodeo happening at the end of July. And one of their precautions, they said, was that everybody, all attendees would be required to wear masks. And because they were wearing masks, they would not have to institute the 6-foot distancing guidelines. That seems like a misreading of the guidelines. What is your opinion on that?
Yeah, so it's really important to understand that masks are not a replacement for social distancing. Masks do not eliminate the risk of spread due to COVID-19. They have been shown to reduce the spread, but the best way to prevent spread of COVID-19 is through social distancing. Now as we, move to opening up parts of our economy and society and having such festivals, it is prudent for organizers to recommend wearing masks or even enforce it, but it's not a replacement for social distancing in terms of preventing spread of COVID-19.
Thank you.
Mm-hmm.
Hi, Dr. Dunn. This is Jacob Klopfenstein with KSL.com. I wanted to ask a little bit about protests and the spread of COVID-19 at protests. Obviously, we've seen some pretty major events here in the last few days. Do you have any tips for people going to some of these protests, and should they get tested after going to protests? Any other tips you can offer specifically regarding protests?
Sure. So with any large gathering, the first and foremost thing is if you've been in close contact with someone who has COVID or you have any symptoms at all, certainly stay home. Don't participate. If you are involved in any large gathering, such as a protest, it's important to maintain social distancing as much as possible, greater than 6 feet away from others. If you have been in a situation where you've been in close contact with people for a prolonged period of time, monitor your symptoms for 14 days, and at the sign of any mild symptoms, stay home and contact your provider or a coronavirus hotline to get tested. If you don't have a symptom, assessing the risk due to a specific event like a protest where we don't have any known positives at this point is really premature. So as we get information in, if we do see a risk to the general public or people who participate in the protest, we'll certainly let you guys know.
Hi, Dr. Dunn, Ben Winslow with Fox 13. With the recommendation by the commission to go to green and the Department of Health making its recommendation not to go to green, what happens next in terms of where we go with this? Because we do have public health orders set to expire by the end of this week, I believe.
Yeah, so both of those recommendations go to the governor's office and he'll determine what policy he wants to set forth.
Do you have any indication of where the governor is leaning on this, or if we're even going to go to orange with this increase in cases?
Yeah, I don't have any indication.
Hi, Sonia Hudson with KUER. I also had a question about protests. Is there any guidance for police officers on who are dealing with protests as far as wearing masks? We saw my colleagues and I saw a lot of police officers not wearing masks, but having, the face shields over. What is the guidance there from the Department of Health?
Yeah, so this was definitely a unique situation. In general, we do recommend law enforcement, similar to the rest of individuals, to wear masks when you're in situations where social distancing isn't possible. The protest response was definitely a unique situation, and public safety leadership was making decisions to protect both the public and their police officers. So that's how those decisions were made. The face shields are a good idea as well. But again, in general situations, masks are a good idea. I can't speak specifically to why they chose not to in this situation, but I know that it was an informed decision.
Sure. Are the face shields less effective than masks, the same?
We don't have in terms of specifically around COVID spread, we don't have a lot of good data around this. The important part is to have a barrier between your mouth and other people in order to prevent the spread of droplets. So just as long as there's a barrier there, it's a good idea.
Got it. Thank you.
Yep. Well, all right. Have a great afternoon. Thank you.
Thank you so much.